Hi everyone, we're about to get started momentarily. Today we're going to be talking about Breast Cancer Awareness Month and flu shots and breast cancer prevention and early detection and self-exams. So stay tuned, we will get started in a second. And my co-host should be hopping on any second. Hey Rama, how are you?
Hi, Joel. How are you?
Good, happy Wednesday.
Happy Wednesday, as they call it.
Cool. My name is Jewel. I work in the External Affairs Department as Director of Communications. My pronouns are she, her, hers.
Hi, everyone. My name is Rama. I work in the Community Health Department, and my are
Ooh, Rama, I'm hearing like every other word. Is your microphone blocked by any chance?
oh. Let me get my life together.
The life looks together, for reference.
Thank you. Please hold. It's really me taking a picture of the screen for me. How about now?
Much better, much better.
Much better?
Yeah, sounds good.
Okay. My name is Rama, and I work in the Community Health Department here at Whitman-Walker. Pronouns are she, her, hers. Whitman-Walker's Community Health Department has expanded its outreach efforts, as you all know. We've developed a robust social media outreach platform. We cover various topics from HIV, STI, sexual health practices, safer sexual health practices, access to care, social determinants of health, and general public health interventions. And of course, we focus heavily on the current pandemic that we're in, COVID-19. And this segment is our women's health segment today. And in honor of Breast Cancer Awareness Month, we'll be talking a little bit about COVID-19 vaccines as it relates to breast cancer, and get into a little more about the flu vaccine and the benefits of folks who are living such diagnosis with breast cancer, undergoing treatment, the benefits of them accessing getting both the COVID-19 vaccine and your flu shots. So, Jewel, take us away. Can you tell us what is breast cancer?
Yeah, so according to Environ Health's breast cancer definition, breast cancer is when cells start to grow abnormally and then begin to invade healthy cells in the body. So breast cancer occurs when these abnormal cells form in the tissues of the breast and then can spread to other parts of the body if they aren't detected or treated. So the most significant risk factors for breast cancer are being born or assigned female as someone's sex at birth and growing older. And about 85% of breast cancers occur in women who have no family history of breast cancer. So increasing evidence suggests that environmental toxins, many found in common everyday products, really contribute to breast cancer risk.
Eating green, I heard that. So yeah, breast cancer is really just too common, for there to be the limited resources that we currently have for folks who are diagnosed. So, in addition to to add to the fact that Jewel just mentioned, I'll share some facts with you all. In 2021, an estimated 281,550 new cases of invasive breast cancer will be diagnosed in women in the United States, as well as 49,290 new cases of non-invasive breast cancer. And 63% of breast cancer cases are diagnosed at a localized stage. So, I know we hear a lot, and there are no signs that the cancer has spread outside of the breast. And I know we're really familiar with when folks say, oh, the cancer has metastasized, so it's moved, and localized just means that it's in one area. Metastasized just means that it's the cancer cells have formed into another part of your body. Um, so for localized stages, for the most part, the 5-year survival rate is at about 99%, and that's heavily based on early detection. Breast cancer is the most common cancer in American women, except for skin cancers. So make sure you have the SPF. It is estimated that in 2021, approximately 30% of all new cancer diagnoses in women will be breast cancer. Again, it's like the most common cancer for women for the most part, outside of skin cancers I mentioned. And as you know, overall, Black women are most likely to die of breast cancer than women of other racial or ethnic groups. And this is due to many factors, but something to really keep in mind is the reduced access to quality health care and the institutionalized racism, in which, when it comes to disparities, health disparities, folks from our communities and it's most common for us, and again, heavily based on the healthcare system, the biases, and the institutionalized racism, and the fact that we really don't have access to quality care. So a lot of us go undiagnosed, untreated. So early detection isn't an option because we don't have the access to it in a lot of our neighborhoods, and we have a lot of barriers, like structural and systemic barriers. So, and higher rates and another thing is higher rates of forms of breast cancer that are hard to treat also play as a role as to why that's commonly found in Black women. Also, a large Dutch study of transgender people using hormone therapy showed an increased risk of breast cancer in trans women compared with cisgender men, and a lower risk in trans men compared with cisgender women. This suggests that hormones treatments alters the risk of breast cancer in transgender people compared with initial risk based on their sex assigned at birth. So folks who are undergoing some hormone therapy, it's just really important to ensure that you are having the conversations with your providers, still doing the breast and chest exams, whether it's the self-exams or it's done by your provider. So just make sure you're staying on top of that and consistently going to your doctor's visit.
Thank you for a lot of information, Rama. So important. Prevention is always our best step. So, the sooner that folks can detect cancer or detect that lump and get in treatment, the better, and the better that their outcomes will be. So, as we know, the pandemic delayed a lot of things, including early detection and screenings for breast cancer and other cancers. According to the LA County Department of Health, from their Office of Women's Health, there will be 10,000 excess deaths this year in the U.S. from breast cancer and colorectal cancer alone over the next decade. Sorry, I said that horribly. According to the LA County Department of Public Health's Office of Women's Health, there will be 10,000 excess deaths in the U.S. from breast and colorectal cancer alone over the next decade because of pandemic-related delays in cancer screenings and treatment. There was such a great delay, and some people were prevented from getting access to cancer preventative screenings, that Whitman-Walker was actually fortunate enough to host our First Lady, Dr. Jill Biden, within her first 48 hours in office to talk about the importance of cancer prevention during the COVID-19 pandemic.
Yeah, as Joel mentioned, it's just the pandemic has definitely caused a concerning decrease in cancer screening rates and widening the existing health disparities, especially in our Black and Brown communities. So being vaccinated against COVID-19 may cause temporary swelling to the lymph nodes. um, in the armpit. This side effect of the vaccine may be mistaken for a sign of breast cancer. So some oncology experts recommend that folks wait 4 to 6 weeks after completing the COVID-19 vaccination before getting a mammogram. Because, sometimes when your body detects something new or you're fighting off something, just like we're building the antibodies against COVID-19, our lymph nodes, the possibility of our lymph nodes swelling is very common on underarms or back here. So sometimes it's really important to just like wait a little bit, and conversations to have with your oncologist, and to have with your primary care physician or your GYN. Just make sure that you're always in the loop, having conversations with your providers. So the vaccines was is developed, it helped folks to safely attend doctor's visits so that they're able to receive the cancer screenings and prepare their treatment plans if they are diagnosed. So a breast cancer diagnosis leads to a compromised immune system. So in addition to protecting yourself against COVID with the vaccine, it's important to make sure that we are also getting our flu shots as well, especially around this time of year.
Yeah. If you identify as a person who's undergoing cancer treatment, you definitely want to protect your immune system as much as possible. And the flu vaccine helps prevent millions of illnesses and flu-related medical visits each year. So, big question for you, Rama. Have you gotten your flu vaccine yet this year?
I have gotten my flu vaccine. Me.
Yeah.
I've got my COVID-19 vaccine. First dose, second dose, third dose. Um, so definitely an added extra layer of protection. So getting the flu vaccine, um, it's just as important as getting the COVID-19 vaccine to me, because as someone with an who is immunocompromised, the layers of protection are something that I'm really thankful for. Kind of allows me to be able to go to my doctor's visits regularly. Again, as we mentioned, prevention and early detection are definitely key. So my COVID-19 vaccine and the flu shots really allow me to operate the world in like the safest way as possible. And that kind of goes for everyone, especially if you have to be in spaces of like in the hospital, like really crowded spaces, so it's just, it allows me to breathe, honestly, to take it a little lighter. What about you?
I have not gotten my flu vaccine yet, but I do plan to walk into a Safeway or CVS or a Giant or Walgreens, so many options for grocery stores, and get it within this weekend. So super excited for that. Big fan of vaccines myself. I remember I honored Halloween last year by getting my flu vaccine. Since we didn't have COVID-19 vaccines at the time, I definitely wanted to commemorate the day somehow.
Oh,
But
wow.
I had to get vaccinated.
You go. Exactly. So, again, when it comes to Breast Cancer Awareness Month, just remember to make sure one thing too that's really vital is to ensure that you're doing those regular chest and breast self exams, as we mentioned earlier. And you can make, when you go to your well woman exams, when you go well woman visits, when you attend your primary care visits, or any of the regular visits that you go to with your physicians, just ask for it. And I actually, or get like a shower card or something, just support them how to do it 7 days before your menstrual cycle for folks who get a menstrual cycle, and 7 days after is a good time. Like for me, that's when I check it for myself. What about you, Jewel? Do you have well woman exams, and like where you check your tatas or your chest?
Yes. Yeah. So actually, I got one over the summer. Since we didn't get to go last year,
Mm-hmm.
uh, it went perfectly fine. It went really, really well. I did get to learn that I've got a really dense chest, which just makes it harder for me as a person to individually feel if I've got a lump.
Mm-hmm.
So that was a good thing to learn about my body from going to the doctor, and have them like look around for me as kind of experts in breast and chest exams. But yeah, I'm gonna get more comfortable with my monthly and at home self exams and kind of keep that practice going.
Right, right. And something to remember, the breast tissue is the breast and chest tissue are filled with like possible with lumps. You know, the tissue is not a smooth tissue, you know. So just when you go in there, something it's going to be alarming. Don't go in looking for lumps, you know, but you'll feel it. If you feel something and it won't move, it's usually localized in one place. So just be mindful of that and really ensuring that you're getting that. And if you have a family history of it, a lot of folks are thinking about, you know, insurance coverage and things like that. Um, it's really important to make sure you have conversations with providers, and for the most part, it's covered for your insurance. But we do screening is typically for folks between starting from the ages of 40 to about 74, according to the CDC. So that's when you should start screening, but you can start screening as early as 10 years prior to the date. Like, let's say if a maternal parent was diagnosed with breast cancer 10 years prior to the age that they were diagnosed, you can start getting your mammograms and it'll be covered by insurance. So just know that it's important to advocate for yourself, especially our Black and brown women, where we are at a disadvantage. So again, you know, we have our numbers down there. If you want to connect with us, whether we can talk through your well woman exams and discuss the tissues and how to conduct those well woman exams at home, your breath and chest health, we can definitely support you there. And to get your COVID-19 vaccine as an extra added layer protection of your immune system, so that you're able to attend your mammography visits, your treatment plan visits. And so please make sure that you connect with us and check the number down below. And if you are in DC and you're looking to get vaccinated, coronavirus.dc.gov is there, and we have walk-up sites, and of course Whitman-Walker is here for you too, just calling that number. And if you're in Virginia, vaccinania.gov, it's a great place to go to get where all the sites that you need. And if you're in Maryland, covidlink.maryland.gov is another place to go. And please remember, we are still in the pandemic. And know your family history and be mindful of our survivors, you know, of breast cancer this month, and those that we have lost to breast cancer. So happy Breast Cancer Awareness Month. Check your tatas and your chest and call Whitman-Walker for support. And we are here for you.
Yes, we are. And just wanting to kind of retweet Rama, if you're in a space where you are asking for certain preventative treatments or screenings, not treatments, preventive screenings, because of your family history, and maybe a doctor says, oh, you don't need this, ask them to document it in your chart as a refusal, just so that it's there on paper. I just know it's really hard for us as Black women to kind of say, hey, I need this thing, and have someone say, oh, you need this thing, let me give you this thing. So I've heard of that tip or trick to see that hopefully works to help you advocate for yourself in those spaces. But finally, again, happy Breast Cancer Awareness Month. And if you're looking for a way to support Whitman-Walker Health this year, this Saturday, October 23rd, marks the 35th anniversary of our Walk in 5K to End HIV. It was formerly known as AIDS Walk Washington, and was an event that started out of there not being any allocated federal funds to support HIV research and treatment research back in the 80s. So today that event turns 35. We have a $450,000 goal for fundraising, and we need your support. Please feel free to go to walktoendhiv.org to register to walk, run, or donate today. And you can actually donate through the end of the year on December 31st, 2021. So please, we look forward to hopefully seeing you out in the streets in DC, or with your post tagged with hashtag walktoendhiv this weekend, doing the walk or run from wherever you are in the world. Again, register at walktoendhiv.org, and we thank you so much for joining us for this Breast Cancer Awareness Month Live.
Thank you. Bye, everyone.